The triage bay at 3 in the morning had a particular kind of quiet, the exhausted silence between emergencies. I was reviewing labs on a tablet when the automatic doors slid open and she walked in. Not stumbled, not carried, walked, with the kind of posture that suggested she was used to being watched. She wore oversized sunglasses despite the hour, a silk scarf wrapped loosely around her neck, and carried herself with a careful grace that immediately caught my attention. The triage nurse, Maria, looked up from her station and did a double take. I saw her mouth form a silent, "Oh my God," before she recovered her professional composure. "Name?" Maria asked, fingers poised over the keyboard. "Sophia Navarro." The voice was unmistakable, rich, layered, the kind that could fill a concert hall without a microphone. Even speaking those two words carried melody. Maria's pen paused. "The Sophia Navarro?" A slight nod. The scarf shifted, and I caught a glimpse of what she'd been hiding. My medical training kicked in before my brain could process the celebrity standing in front of me. There was a mass, visible, irregular, located on the left anterior triangle of her neck. "What brings you in tonight?" Maria continued, professional despite the tremor in her voice. Sophia's hand moved to her throat, fingers hovering without touching. "I can't lose my voice." The words came out firm, but I heard the fracture beneath them. "I have a tour starting in 6 weeks, sold out, 16 cities. I need someone to tell me this is nothing." Maria and I exchanged a look. That mass wasn't nothing. "Any pain?" Maria asked. "Some. When I swallow, when I sing the high notes." She paused. "When I breathe deeply." "How long have you noticed it?" Sophia's fingers tightened around the strap of her designer bag. 3 months, maybe 4. 4 months. My chest tightened. 4 months of a visible neck mass, and she'd waited until 3 a.m. to seek help. I knew why. The same reason anyone waited. Fear. The desperate hope that ignoring something might make it disappear. I stepped forward. "Ms. Navarro, I'm Dr. Noah Reyes. I'm one of the residents here. Would you mind if I took a look?" She turned toward me, and even through the dark lenses, I could feel the weight of her gaze. "You're going to tell me it's bad, aren't you?" I chose honesty. "I'm going to tell you what I see, but we'll need tests to know for certain." She removed the sunglasses slowly, revealing eyes that were simultaneously defiant and terrified. Dark circles beneath them suggested sleepless nights. "Everyone wants something from me. My voice, my time, my image. All I want is to keep the one thing that's actually mine. We'll do everything we can," I said. She unwound the scarf, and the mass became fully visible under the harsh fluorescent lights. Roughly 4 centimeters, firm-looking, fixed to underlying structures, non-tender on visual assessment. The location and characteristics made my mind race through differential diagnoses: thyroid malignancy, lymphoma, metastatic disease, parathyroid adenoma. I pulled on gloves and approached carefully. "I'm going to palpate the area. It might be uncomfortable." She nodded, her jaw set. My fingers found the mass immediately. Firm, irregular borders, limited mobility. It was adherent to the deeper structures, a concerning sign. As I examined it, I felt her pulse quicken beneath my fingertips. Her breathing became shallow. "Ms. Navarro, Sophia, please." Her voice cracked for the first time. "If you're going to tell me I'm dying, at least use my first name." I stepped back, pulling off the gloves. "I'm not telling you you're dying. I'm telling you we need imaging. Tonight, a CT scan of your neck and chest, possibly an ultrasound. And depending on what we find, a biopsy. And if it's cancer?" The question hung in the air like smoke. Maria had stopped typing, her eyes moving between us. "Then we fight it," I said simply. "But we can't fight what we don't understand." Sophia's hand moved to her throat again, covering the mass as if she could hide it through sheer will. "I have a sound check tomorrow, a radio interview the day after. The tour might need to wait," I said gently. Her eyes filled with tears that she refused to let fall. "My voice is all I have. It's all I've ever had. I was nobody before I could sing. Just another girl from nowhere with nothing special. My voice made me someone. If I lose it..." She didn't finish the sentence. She didn't need to. But what she didn't know yet, what the imaging would soon reveal, wasn't just about losing her voice. It was about whether she'd have a voice to lose at all. I opened my mouth to explain the urgency, to push past her denial with medical facts and statistics. But before I could speak, the doors burst open again. A man in an expensive suit rushed in, phone pressed to his ear, his face tight with barely controlled panic. "Where is she?" he demanded. Then he saw Sophia and rushed over. Thank God. Sophie, what are you doing? You can't just disappear in the middle of the night. The label is losing their minds. We have contracts, obligations. Marcus, not now, Sophia said quietly. Not now? The tour starts in 6 weeks. We have $100 million on the line. I stepped between them. Sir, I'm going to need you to lower your voice. This is a hospital and you're... I know where I am, Marcus snapped. He looked at me for the first time, taking in my scrubs and resident badge with dismissive assessment. Who are you? Dr. Reyes. And you are? Marcus Holloway, Ms. Navarro's manager. And unless you're going to give her some throat lozenges and send her on her way, we don't have time for this. Sophia closed her eyes. Marcus, please. Sophie, whatever this is, we'll handle it after the tour. We can't cancel. Do you know how many people are counting on you? How many jobs depend on this? I looked at Sophia and saw something shift in her expression. The fear was still there, but now it was joined by resignation. I'd seen that look before. Patients who were ready to sacrifice their health for obligation, for duty, for everyone else's needs but their own. Ms. Navarro, I said, ignoring Marcus entirely. Can I speak with you privately for a moment? She nodded, standing with that same careful grace. Marcus started to follow, but I held up a hand. Alone. His face reddened. I'm her manager. I have a right. You have no rights in a medical setting without her explicit consent, I said calmly. HIPAA regulations. So unless Ms. Navarro specifically requests your presence, you'll need to wait here. Sophia looked at Marcus, something unreadable passing between them. Wait here, Marcus, please. I led her to one of the small consultation rooms off the triage area. It was barely more than a closet. 2 chairs, a small desk, a box of tissues that had seen too much use. She sat down heavily, as if the weight of pretending had finally become too much. I pulled up the other chair, facing her directly. Sophia, I need you to understand something. That mass on your neck isn't cosmetic. It's not something we can just monitor and hope for the best. Based on its size, location, and characteristics, there's a significant possibility this is malignant. And if it is, every day we wait is a day it could be growing, spreading, compromising your airway, invading critical structures. She stared at her hands. But it could be benign, right? It could be nothing? It could be, I admitted. But we won't know until we look. And looking means tests, tonight. And if it's cancer? She asked again, her voice barely above a whisper. What then? Surgery? Radiation? Chemo? Possibly, probably. It depends on the type and stage. And my voice? I chose my words carefully. That depends on many factors. Where exactly the tumor is located, what structures it's affecting, what treatment is necessary. But Sophia, I waited until she looked up at me. Your voice matters, but your life matters more. A tear escaped, rolling down her cheek. She wiped it away angrily. You don't understand. My voice is my life. Without it, I'm nobody again. Just Sophia from Riverside with a dead-end future and a mother who worked 3 jobs so I could take singing lessons. Everything I am, everything I've built. It's all because of this. She gestured to her throat. If I lose it, what's the point of surviving? The question gutted me, because I understood it. Not personally, but professionally. I'd seen it in the pianist with carpal tunnel syndrome who'd rather live in pain than risk the surgery. The athlete who'd refused the knee replacement because they couldn't imagine life without running. The artist with cataracts who'd delayed treatment because they were terrified of going blind during recovery. Identity and ability, so intertwined that losing one felt like losing everything. The point, I said quietly, is that you're more than your voice. You're Sophia, the daughter who wanted to honor her mother's sacrifice, the woman who walked in here at 3 a.m. because some part of you knows you deserve to fight for yourself, not just your career. She looked at me then, really looked, and I saw something crack in her carefully constructed armor. I'm scared, she whispered. I know. And that's okay. Fear means you understand what's at stake. But don't let fear make your decisions. She sat in silence for a long moment. Outside, I could hear Marcus's agitated voice, arguing with Maria about hospital protocols, the distant beep of monitors, the wheeze of the automatic doors, the symphony of a hospital that never slept. Finally, Sophia nodded. Okay, do the tests. All of them? Even if it takes hours? All of them. I stood, relief washing through me. I'll get the orders in right away. CT scan first, then ultrasound. We'll have results by morning. She stood too, retying the scarf around her neck with practiced movements. Dr. Reyes? Yes? Thank you for not treating me like Sophia Navarro, the singer. Just Sophia. That's who you are to me, I said. A patient who deserves the best care I can give. As we stepped back into the triage area, Marcus rushed over. Finally. Can we go now? No, Sophia said, her voice steadier than before. I'm staying. I'm getting tests. The tour... She paused, and I saw the grief flash across her face. The tour might have to wait. Marcus's expression cycled through disbelief, anger, and panic in rapid succession. Sophie, you can't be serious. Do you have any idea what canceling will cost? The lawsuits? The breach of contract? I have cancer, Marcus, she said bluntly. The words seemed to surprise even her. At least I might, and I need to find out. The color drained from his face. Cancer? You can't have cancer. You're 28 years old. You're at the peak of your career. You have a mass on my neck that's been growing for 4 months, she finished. And I've been too terrified and too busy to deal with it. But I'm dealing with it now. I watched Marcus process this information, his mind clearly calculating the implications. Financial, professional, public relations. It made my skin crawl, but I understood it. In his world, everything was a problem to be managed, a crisis to be spun. He couldn't help but see her diagnosis through that lens. Okay, he said finally, pulling out his phone. Okay, I'll handle this. I'll call the label, postpone the announcement, work with the legal team. But Sophie, you need to understand. If this gets out, if the media finds out you're in a hospital in the middle of the night, then they find out, she said, a hint of steel in her voice. I'm done hiding. She looked at me and I nodded toward the radiology wing. Let's get started. The hospital St. Halsted's radiology department operated 24/7, but the overnight shift had a different energy, quieter, more focused, staffed by technicians who preferred the solitude of night work. I walked Sophia down the corridor, her heels clicking against the linoleum in a rhythm that echoed off the walls. She'd insisted on keeping the sunglasses on, even indoors. Protection, I realized. Not just from recognition, but from vulnerability. As long as she wore them, she could maintain some distance between herself and the reality closing in. My residency at St. Halsted had been full of these moments, the space between suspicion and confirmation, where patients existed in a limbo of not quite knowing. Some handled it with stoic silence, others filled the void with nervous chatter. Sophia did neither. She simply walked, her hand occasionally drifting to her throat, feeling the mass that had brought her here. I'd been at St. Halsted for 4 months now, and the newness had worn off just enough to reveal the patterns beneath. The hospital had rhythms: morning rounds, afternoon discharges, evening admissions, midnight emergencies. Each shift had its own character, its own challenges. Night shifts, I'd learned, attracted a specific type of case, the ones who'd been in pain all day but convinced themselves it would pass. The ones who'd been too busy or too scared to come in during normal hours. The ones who hoped that darkness might make their problems less real. Sophia Navarro fell into that last category. I knew who she was, of course. You'd have to live under a rock to not recognize the name. 3 platinum albums, multiple Grammy nominations, a voice that critics compared to honey over whiskey, smooth and burning all at once. Her face had been on magazine covers, billboards, streaming platforms. She'd performed at award shows and charity galas, sung the national anthem at the World Series. But that wasn't who walked beside me now. This was just Sophia, scared, exhausted, trying to hold herself together with nothing but willpower and designer scarves. Have you been to many hospitals? I asked, trying to fill the silence with something other than dread. A few, mostly for performances, charity events. One time I sang for a children's ward. She smiled slightly. That was before everything got so big, when I could still do things without an entire team planning it 6 months in advance. Do you miss it? The before? She considered this. Sometimes, the before was simpler. Smaller venues, smaller crowds, but also smaller dreams. I wanted this. The stadiums, the recognition, the ability to make music that reached people. I just didn't realize what I'd have to give up to get it. We reached the radiology suite. The technician, a woman in her 40s named Carol, looked up from her computer and did the same double take I'd seen from Maria. But Carol had been doing this long enough to school her expression quickly. CT scan of the neck and chest, she confirmed, reading the order I'd sent ahead. Yes, with IV contrast. Sophia's hand tightened on her bag. Will it hurt? The contrast might make you feel warm like you're peeing yourself. Carol said with practiced directness. You're not actually peeing yourself. It just feels that way. Some people also get a metallic taste in their mouth. Both sensations pass quickly. Comforting, Sophia muttered, but there was a hint of humor in it. Carol smiled. I've been doing this 20 years. I've learned people prefer honesty over bedside manner. Now, I'll need you to remove any jewelry and metal objects. The scarf too, I'm afraid. Sophia's hand moved to the silk at her neck, and I saw the resistance in her body language. The scarf had been armor. Removing it felt like exposure. It's just us here, I said quietly. No cameras, no media, just medicine. She nodded slowly and unwound the scarf. Without it, the mass was starkly visible, a firm, irregular swelling that distorted the natural contours of her neck. Carol's professional mask slipped for just a second, her eyes widening slightly before she recovered. Okay, Ms. Navarro, let's get you set up. I stepped back, giving them space. Through the window, I watched Carol position Sophia on the scanner table, explaining the procedure in calm, measured tones. Sophia lay perfectly still, her hands folded across her stomach, her eyes fixed on the ceiling. She looked small suddenly, diminished by the massive machinery surrounding her. The scanner hummed to life, and Sophia disappeared into its cylindrical embrace. I pulled out my phone and opened the Notes app, jotting down observations. Visible neck mass, left anterior triangle, approximately 4 cm, firm, irregular borders, fixed to underlying structures. Patient reports progressive dysphagia and odonophagia over 3 to 4 months. No reported weight loss, but will need to verify. No lymphadenopathy palpated in other regions, but imaging will provide better assessment. My attending, Dr. Chen, had taught me to document everything in real time. Your memory is excellent until it isn't, she'd said during my first week. Write it down, even the small details, especially the small details. They matter. The scan took 20 minutes. When Carol wheeled Sophia back out, her face was pale, the false warmth of the contrast long faded. How do you feel? I asked. Like I want to know and don't want to know at the same time, she said. Is that normal? Completely. How long until we have results? The radiologist will read them within the hour, but Sophia, I paused, choosing my words carefully. You should prepare yourself. Based on what I saw during the physical exam, there's a high likelihood this is something serious. That doesn't mean hopeless, but it means we need to be ready to act quickly. She closed her eyes. I know. I think I've known for a while. I kept thinking if I ignored it, if I stayed busy enough, it would go away. Stupid, right? Human, I corrected. Fear makes us do illogical things, but you're here now. That's what matters. We returned to the ER. Marcus had commandeered a corner of the waiting room, phone pressed to his ear, his free hand gesturing emphatically. When he saw Sophia, he ended the call abruptly and rushed over. How did it go? What did they find? We won't know for a bit, Sophia said. They have to read the scans. But the doctors think it's serious? She glanced at me. I kept my expression neutral, deferring to her. This was her story to tell, her information to share. Yes, she said finally. They think it's serious. Marcus ran a hand through his hair, the perfect styling coming undone. Okay. I can work with serious. We'll need to craft a statement, control the narrative. Maybe we frame it as you taking time for your health, being responsible. Marcus, Sophia's voice cut through his planning like a blade. I might have cancer. I might need surgery. I might lose my voice. Can you stop thinking about the PR for 5 minutes and just be human? He stared at her, stung. I'm trying to protect you. That's my job. If this gets out the wrong way, if people think you're dying, she supplied, weak, unable to fulfill your contracts, that's not what It is exactly what you meant. She sank into one of the waiting room chairs, exhaustion finally overtaking adrenaline. And maybe you're right. Maybe I am all those things. But right now, I just need to get through the next few hours without falling apart. Can you help me do that? Or do I need to ask you to leave? Marcus's jaw worked, emotions playing across his face. Finally, he sat down beside her, his voice softer. I'm sorry. You're right, I'm scared too, Sophie. Not for the tour, for you. She leaned her head on his shoulder, and I saw the relationship clearly for the first time. Not just manager and client, friends, maybe family, people who'd built something together and were watching it potentially crumble. I gave them privacy, returning to the nurse's station where Maria was updating charts. She seems nice, Maria said quietly. Not what I expected from a celebrity. She's just a person, I said. A terrified person. Aren't we all when it comes down to it? Maria pulled up Sophia's chart on the computer. Results should be coming through soon. Dr. Chen wanted you to page her as soon as we have them. I nodded, settling into a chair to wait. The ER had picked up slightly. A drunk driver brought in by police, a teenager with an asthma attack, an elderly man with chest pain. I monitored them peripherally, but my mind stayed on Sophia, on the mass I'd palpated, on the fear in her eyes when she'd asked about losing her voice. 35 minutes later, my pager buzzed. Radiology results available. I pulled up the imaging on the nearest computer terminal, and my stomach sank. The mass was even worse than I'd feared. The CT images loaded in sequential slices, painting a picture I'd hoped not to see. The mass originated from the left thyroid lobe, measuring 4.2 centimeters at its greatest dimension. But size wasn't the most concerning feature. It was the invasion. The tumor had broken through the thyroid capsule and was infiltrating the surrounding structures. Tendrils of abnormal tissue wrapped around the left recurrent laryngeal nerve, the nerve responsible for vocal cord movement. There was also extension toward the trachea, with possible invasion of the tracheal wall. Multiple enlarged lymph nodes dotted the left cervical chain, the largest measuring 2.1 centimeters. The radiologist's impression was written in the careful language of someone who knew they were potentially delivering a death sentence. Large heterogeneous mass arising from left thyroid lobe with extracapsular extension and probable recurrent laryngeal nerve involvement. Multiple pathologic appearing cervical lymph nodes. Findings highly suspicious for thyroid malignancy, likely papillary or anaplastic carcinoma. Recommend urgent ENT consultation and tissue diagnosis. Given the extension and lymphadenopathy, staging workup including PET-CT should be considered. I sat back, absorbing the implications. This wasn't just thyroid cancer. This was advanced thyroid cancer, with the kind of spread that made simple surgical resection complicated. The recurrent laryngeal nerve involvement meant that removing the tumor risked permanent vocal cord paralysis, on one side, but if the tumor continued to grow, it could paralyze the cord anyway. Or worse, compress the trachea, compromising her airway entirely. I pulled out my phone and paged Dr. Chen, then called the ENT resident on call. This was beyond my scope as an internal medicine resident. Sophia needed specialists immediately. Dr. Chen arrived first, her silver hair pulled back, her eyes sharp despite the early hour. She reviewed the images in silence, her expression growing grimmer with each slice. Recurrent laryngeal nerve involvement, she said finally. That complicates everything. If she needs surgery, when she needs surgery, Dr. Chen corrected. And yes, the nerve involvement significantly increases the risk of permanent voice change or loss. Even in the best hands, with the most careful dissection, that nerve is compromised. You can see it here, she pointed to the screen. The tumor has essentially encased it. Any attempt to remove the mass will require either sacrificing the nerve or attempting to dissect it free, which carries its own risks. And if we don't operate, the tumor continues to grow. Eventually, it obstructs her airway, invades more vital structures, or metastasizes further. If it's anaplastic carcinoma, which I hope it's not, the prognosis is measured in months without aggressive intervention. I thought about Sophia in the waiting room, her hand on Marcus's shoulder, probably hoping for good news, hoping we'd tell her it was nothing, a benign nodule, an enlarged lymph node, anything but this. How do I tell her? I asked quietly. Dr. Chen looked at me, her expression softening. Honestly, compassionately, and you don't do it alone. The ENT team needs to be part of this conversation. Let me see if I can get Dr. Sullivan down here. Patricia Sullivan was the head of the ENT department, a surgeon with 30 years of experience and a reputation for being both brilliant and demanding. Getting her to come down at 4 a.m. for a consult was like summoning a deity, possible, but requiring significant justification. Dr. Chen made the call, speaking in low, urgent tones. I couldn't hear the entire conversation, but I caught phrases: advanced thyroid malignancy, recurrent laryngeal nerve invasion, patient is a professional singer. That last detail seemed to shift something. Dr. Chen nodded, ended the call, and turned to me. She'll be here in 20 minutes. In the meantime, we need to prepare Sophia. She needs to understand what we're seeing and what it means. We walked back to the waiting room together. Sophia saw us approaching and stood immediately, reading our expressions. "It's bad," she said. Not a question, a statement. "Let's talk somewhere private," Dr. Chen said gently. We returned to the small consultation room. This time, Marcus came with us, his PR instincts overridden by genuine concern. Dr. Chen waited until we were all seated, then pulled out a tablet, bringing up the CT images. Sophia, I'm Dr. Miriam Chen. I'm the attending physician overseeing your care tonight. Dr. Reyes asked me to review your imaging with you. Sophia's eyes locked on the screen, even though I doubted she could make sense of the grayscale images. That's inside me? This is a cross-sectional view of your neck, Dr. Chen explained, using a stylus to circle the mass. This area here is your thyroid gland. It's a butterfly-shaped gland that sits in the front of your neck, responsible for producing hormones that regulate metabolism. This larger area, she traced the irregular mass, is a tumor arising from the left side of your thyroid. Sophia's breathing quickened. Marcus reached for her hand. How bad? Sophia asked. Dr. Chen met her eyes directly. It's significant. The tumor is approximately 4 centimeters, and it's grown beyond the capsule of the thyroid gland. It's involving some of the structures around it, including lymph nodes in your neck. Most concerning, she pointed to a thin line on the image, is this nerve here. It's called the recurrent laryngeal nerve, and it controls the movement of your left vocal cord. The tumor has grown around it. The room fell silent, except for the hum of the ventilation system. Sophia stared at the image, her face draining of color. What does that mean? She whispered. For my voice? Dr. Chen chose her words carefully. It means that treatment, which will almost certainly require surgery, is complicated. Removing the tumor risks damaging that nerve, and damage to the recurrent laryngeal nerve can cause vocal cord paralysis. Can cause or will cause? Can. It's not certain. The surgeon will do everything possible to preserve the nerve, but given how involved the tumor is, there's a significant risk. We won't know the full extent until surgery, and even then, nerve function can take months to fully assess. Sophia stood abruptly, pacing the small room like a caged animal. No, there has to be another option. Radiation? Chemotherapy? Something that doesn't risk my voice? We'll need a tissue diagnosis first. A biopsy to determine exactly what type of cancer this is, Dr. Chen explained. But thyroid cancers are generally treated with surgery first. Depending on the type and stage, radiation or chemotherapy might follow. But surgery is the primary treatment. And if I refuse? The question hung in the air like a live wire. Dr. Chen didn't flinch. Then the tumor continues to grow. Eventually, it will affect your airway, making it difficult to breathe. It could invade other vital structures in your neck, major blood vessels, your esophagus. And if it's an aggressive type, it will metastasize to other organs. Without treatment, Sophia, this will kill you. Marcus made a choked sound. Sophia stopped pacing, her back to us, her shoulders shaking. How long? She asked. That depends on the type. If it's papillary thyroid cancer, the most common type, it's generally slow growing. You might have years even without immediate treatment. But if it's anaplastic, which is rare but aggressive, you might have months. We need the biopsy to know. Sophia turned around, and tears were streaming down her face now, no longer held back. This can't be happening. I have a tour. I have people counting on me. I finally have everything I worked for, and now you're telling me I have to choose between my voice and my life. I'm telling you that we need to prioritize your life, Dr. Chen said gently. Your voice is important. I understand that, but no, you don't, Sophia interrupted, her voice breaking. You don't understand. My voice isn't a hobby. It isn't even a career. It's who I am. It's the only thing that makes me special. Without it, I'm nothing. I stepped forward. That's not true. She looked at me, her eyes red and desperate. You don't know me. I know that you walked in here at 3 a.m, scared out of your mind, but you came anyway. I know that when your manager wanted to leave, wanted to protect the tour and the contracts, you chose to stay and face this. I know that takes courage that has nothing to do with singing. Courage doesn't pay my mother's mortgage, she said bitterly. It doesn't fulfill my contracts or maintain my relevance. My voice does that. And you're asking me to risk losing it. I'm asking you to risk changing it, I corrected. There's a difference. Even if the nerve is affected, even if your voice changes, it doesn't mean you can't sing. It means you have to adapt, relearn, find a new way. You don't get it, she said, but there was less conviction in her voice now. Before I could respond, there was a knock on the door. A woman in her late 50s entered, wearing scrubs and an air of absolute authority. Dr. Patricia Sullivan had arrived. Ms. Navarro, she said, extending a hand. I'm Dr. Sullivan, head of ENT surgery. Dr. Chen called me about your case. I've reviewed your imaging, and I'd like to examine you if you're willing. Sophia wiped her eyes and nodded mutely. Dr. Sullivan's examination was thorough and efficient. She palpated the mass, assessed Sophia's range of neck motion, examined her oral cavity and throat with a small light. Then she pulled out a flexible laryngoscope, a thin, camera-tipped tube that would allow her to visualize Sophia's vocal cords directly. This might be uncomfortable, Dr. Sullivan warned, but it's necessary. I need to see how your vocal cords are moving. The exam took only a few minutes, but Sophia gagged several times, tears streaming down her face from the irritation. When Dr. Sullivan removed the scope, her expression was grave. Your left vocal cord is already showing decreased mobility, she said. It's not completely paralyzed, but it's not moving normally either. That suggests the tumor is already affecting the nerve, even before any surgical intervention. Sophia's hand flew to her throat. But I can still sing. I was recording just 2 days ago. I sounded fine. You're compensating, Dr. Sullivan explained. Your right vocal cord is working overtime to make up for the left. But as the tumor grows, that will become harder. Eventually, impossible. So I'm losing my voice anyway? Sophia's voice cracked. Surgery or no surgery, I'm losing it? Dr. Sullivan's expression softened slightly. Not necessarily losing it entirely, but changing it? Yes, that's inevitable at this point. The question is whether we can preserve enough function to give you options, or whether we wait and risk more extensive damage, or worse. Sophia sank back into the chair, her body curling inward like she was trying to make herself smaller, trying to disappear. Marcus put an arm around her, his own eyes wet. What do I do? Sophia whispered. Dr. Sullivan pulled up a chair, sitting at Sophia's eye level. Here's what I recommend. First, we do a fine needle aspiration biopsy tomorrow morning. Today morning, technically. It's a quick procedure where we use a small needle to take cells from the mass and examine them under a microscope. That will tell us what type of cancer we're dealing with. Once we have that information, we can stage the cancer, determine the best surgical approach, and give you a realistic prognosis. And the surgery itself would involve removing at least the left lobe of your thyroid, possibly the entire thyroid depending on what we find. We'd also need to remove the affected lymph nodes. During the surgery, I'll do everything in my power to preserve the recurrent laryngeal nerve. But I have to be honest with you, given the tumor's location and the fact that your cord is already showing impaired movement, there's a significant chance the nerve is too involved to save. How significant? 50-50, Dr. Sullivan said bluntly. Maybe better, maybe worse. We won't know until we're in there. Sophia was quiet for a long moment. When she spoke, her voice was small. And if the nerve can't be saved, what then? Then your left vocal cord will be permanently paralyzed in a partially open position. Your voice will be breathy, weak. You'll have trouble projecting, trouble with higher notes. You might aspirate when you drink liquids, meaning fluid could go down the wrong way, into your lungs instead of your esophagus. Could I still sing professionally? Dr. Sullivan hesitated. With extensive voice therapy, some patients regain significant function. There are also surgical procedures that can help reposition a paralyzed vocal cord. But would you sound the same? No. Could you sustain a touring schedule singing 2-hour concerts? That's uncertain. The words landed like hammer blows. I watched Sophia process each one, watched her dream of the tour, the stadiums, the life she'd built, crumble in real time. I need to think, she said finally. I need time. You don't have much time, Dr. Sullivan said, not unkindly. I understand this is overwhelming, but every day we wait is a day that tumor grows. If it's an aggressive type, delays can significantly impact outcomes. How long can I think? 24 hours, Dr. Seikas, Sullivan said. We'll do the biopsy in the morning. By tomorrow evening, we'll have preliminary results. At that point, we need a decision about surgery. Sophia nodded numbly. Dr. Sullivan stood, placing a hand briefly on Sophia's shoulder. I know this isn't what you wanted to hear, but you're young, you're strong, and we caught this before it became imminently life-threatening. There's reason for hope, Sophia. Just a different hope than you walked in with. After Dr. Sullivan left, the room fell into heavy silence. Marcus was the first to speak. We'll figure this out, Sophie. We'll get second opinions, find the best surgeons. Dr. Sullivan is one of the best surgeons. Dr. Chen interjected quietly. I've worked with her for 15 years. She's published extensively on thyroid cancer. If she's recommending this course of action, it's because it's the right one. Marcus nodded, chastened. Then we'll handle it. We'll postpone the tour, restructure the contracts, cancel it, Sophia said. What? Cancel the tour. All of it. She looked at Marcus, her expression hollow. If I'm going to lose my voice anyway, I don't want the last thing I do with it to be disappointing millions of people halfway through. Better to cancel now than collapse on stage in week 3. Sophie, you don't know that will happen. Yes, I do. She stood, rewrapping the scarf around her neck with shaking hands. I felt it. These past few weeks, hitting the high notes has been harder. I thought I was just tired, but it's been the tumor, hasn't it? It's been strangling my voice this whole time, and I was too stupid or too scared to admit it. You weren't stupid, I said. You were human. She looked at me, and for a moment, the mask slipped entirely. She wasn't Sophia Navarro, the Grammy-nominated singer. She was just a 28-year-old woman facing her mortality and the loss of everything that defined her. I'm going to do the biopsy, she said quietly, and depending on what it shows, I'll decide about the surgery. But right now, I need air. I need to get out of this room that smells like antiseptic and bad news. We should keep you for observation, Dr. Chen started. I'm not staying overnight, Sophia said firmly. You said I have 24 hours to think. I'm going to think. At home, where I can breathe. Dr. Chen looked like she wanted to argue, but she nodded. Okay, but if you experience any difficulty breathing, any increase in pain, anything concerning, you come back immediately. Understood? Understood. Dr. Chen pulled out a prescription pad. I'm giving you something for pain and anxiety. Take them as needed. And Sophia? She waited until Sophia met her eyes. Try to get some rest. Tomorrow's going to be difficult. Sophia took the prescriptions with a nod. Marcus helped her gather her things, and they prepared to leave. At the door, Sophia turned back to look at me. Dr. Reyes? Yes? Earlier you said I was more than my voice, that I had courage. She paused. I hope you're right, because I'm about to need all of it. Then she was gone, Marcus trailing behind her like a worried shadow, leaving me standing in the consultation room that still smelled faintly of her perfume and the sharp tang of fear. Dr. Chen sighed heavily. That's going to be a tough case. Will she make it? Medically? Probably. Most thyroid cancers are treatable, even at advanced stages. But emotionally? Dr. Chen shook her head. That's harder to predict. Losing the thing that defines you, that's its own kind of death. Some people survive it, some don't. I thought about Sophia's eyes when she'd said, without my voice, I'm nothing. I thought about the desperation in her voice, the way she'd curved inward like she was trying to protect something already lost. And I wondered which kind of survivor she would be. The biopsy was scheduled for 10 a.m., which gave me time for a few hours of sleep in the residence lounge. But sleep didn't come easily. Every time I closed my eyes, I saw those CT images, the tumor wrapped around the recurrent laryngeal nerve like a python around its prey. I dealt with cancer patients before. In 4 months of residency, I'd seen lung cancer, colon cancer, breast cancer, leukemia. I'd held hands while delivering bad news, sat with families in waiting rooms, documented progression and remission in clinical notes that stripped away humanity in favor of medical accuracy. But something about Sophia's case felt different. Maybe it was her age, 28, only a year older than me. Maybe it was the specificity of the loss she faced. Not just death, but the death of identity. Or maybe it was the way she'd looked at me when she'd asked if I thought she was more than her voice, like she desperately needed someone to believe it even if she couldn't. I gave up on sleep around 7:30 and headed to the cafeteria for breakfast. The hospital was shifting from night mode to day mode. More staff in the hallways, more noise, the energy changing from nocturnal focus to bureaucratic bustle. Dr. Chen found me halfway through a mediocre omelet and terrible coffee. Sophia Navarro's here, she said. Early. She's in pre-op. I abandoned breakfast and headed to the surgical wing. Sophia sat on an exam table in a hospital gown, her hair pulled back, her face scrubbed clean of makeup. Without the armor of style and glamour, she looked younger, vulnerable. Marcus stood beside her, and this time he wasn't on his phone. He just held her hand, both of them silent and pale. Good morning, I said, keeping my voice gentle. Is it? Sophia asked, but without malice, just exhaustion. How are you feeling? Terrified, but ready, I think. She looked at me. Will it hurt? The biopsy itself shouldn't. We'll use local anesthetic to numb the area. You'll feel pressure, maybe some discomfort, but not pain. The whole thing takes about 15 minutes. She nodded, processing this. And then we wait? Then we wait. The pathologist will examine the cells under a microscope. We should have preliminary results by this evening. Full results within 48 hours. Dr. Sullivan entered, accompanied by a pathologist I didn't recognize, a thin man in his 60s with wire-rimmed glasses and careful hands. Dr. Sullivan greeted Sophia with professional warmth, explaining the procedure once more, ensuring consent was truly informed. "I'm going to use ultrasound guidance," Dr. Sullivan explained, wheeling over a small ultrasound machine. "This lets me see exactly where I'm putting the needle, ensuring we get good tissue samples. You'll be awake the whole time. Some patients prefer to look away, others prefer to watch on the screen. Either is fine." "I'll watch," Sophia said immediately. "I need to see it. The thing that's trying to kill me." Dr. Sullivan respected that, angling the screen so Sophia could view it. She applied gel to Sophia's neck, then placed the ultrasound probe against her skin. The grainy black and white image appeared, and there it was. The mass, dark and irregular, its borders invasive and wrong. "That's it," Dr. Sullivan said quietly. "That's your tumor." Sophia stared at the screen, transfixed. "It's bigger than I thought." 4.2 centimeters, Dr. Sullivan confirmed. "About the size of a walnut." "A walnut is killing me. We're not going to let it," Dr. Sullivan said firmly. She prepared the biopsy needle, a thin, hollow needle attached to a syringe. "Okay, Sophia, you're going to feel a stick from the local anesthetic. It'll sting for a few seconds." Sophia closed her eyes, breathing deeply. The needle went in and she flinched slightly but didn't make a sound. Dr. Sullivan waited for the anesthetic to take effect, then prepared the biopsy needle. "Here we go. Deep breath in and hold it for me." The biopsy needle advanced under ultrasound guidance, penetrating the mass. "Doctor." Sullivan made several passes, collecting tissue samples, her movements precise and efficient. The pathologist took each sample, smearing cells onto glass slides, his expression neutral but focused. After the 5th pass, Dr. Sullivan withdrew the needle and applied pressure to the site. "All done. You did great." Sophia opened her eyes, her hand immediately going to her neck, feeling the small bandage now covering the biopsy site. "That's it? That's it. We have what we need. Now we wait for the pathology." The pathologist left with his slides, and Dr. Sullivan cleaned up the equipment. Before leaving, she turned to Sophia. "Whatever this is, we're going to face it together. You're not alone in this." After she left, Sophia sat in silence for a long moment. Then quietly, "I called my mother this morning." Marcus looked surprised. "You did?" "I had to. She deserved to know before she saw it on TMZ or something." Sophia's voice cracked slightly. She cried. "I've never heard my mother cry like that. She's always been so strong, you know. Worked 3 jobs after my father left, never complained, just kept going, and I made her cry." "You didn't make her cry," I said gently. "Cancer made her cry. Fear made her cry. But you? You're being strong, just like she taught you." "I don't feel strong. I feel like I'm falling apart, and I'm barely holding the pieces together." "That's what strength looks like sometimes," I said. "Not fearlessness, but facing fear anyway." We moved her to a recovery area where she could rest while the local anesthetic wore off. I checked in periodically throughout the day between my other patients, a teenager with appendicitis, an elderly woman with pneumonia, a middle-aged man with uncontrolled diabetes. Each case required focus, attention, empathy, but my mind kept drifting back to Sophia, waiting for results that would determine her future. Around 6 p.m., my pager buzzed. "Pathology results ready." I found Dr. Chen and Dr. Sullivan in the pathology lab, staring at slides under microscopes. Their expressions told me everything before they spoke. "Papillary thyroid carcinoma," Dr. Sullivan said, "with areas of tall cell variant." My stomach dropped. Papillary thyroid cancer was common and generally had an excellent prognosis, but the tall cell variant was more aggressive, more likely to invade local structures and metastasize. "Stage?" I asked. "At least T3N1B based on imaging," Dr. A. Sullivan said. "The tumor has extended beyond the thyroid capsule, and there's extensive lymph node involvement. We'll need the surgical pathology to confirm, but I'd estimate stage 3, possibly stage 4, depending on whether there's distant metastasis. Prognosis? With aggressive treatment, surgery, radioactive iodine, possibly external beam radiation. 5-year survival is around 70 to 80% for tall cell variant at this stage. 10-year survival drops to about 60%. The numbers hung in the air. 70 to 80% sounded good until you flipped it. 20 to 30% chance of death within 5 years. For a 28-year-old woman, that was devastating. "And her voice?" I asked, though I already knew the answer. Dr. Sullivan's expression was grim. Given the nerve involvement and the need for extensive lymph node dissection, I'd say there's an 80% chance of permanent recurrent laryngeal nerve damage. Her voice will change. How much, we won't know until after surgery and recovery. I thought about Sophia's face when she'd said, "Without my voice, I'm nothing." When do we tell her? I asked. Now, Dr. Chen said. She's been waiting all day. She deserves to know. We found Sophia in the same recovery area, Marcus beside her. They both stood when we entered, reading our expressions. "It's cancer," Sophia said. Not a question. "Yes," Dr. Sullivan confirmed. She spent the next 20 minutes explaining the diagnosis, the staging, the treatment plan. Sophia listened with unnatural stillness, her face expressionless, like she'd gone somewhere far away to protect herself from the words. When Dr. Sullivan finished, Sophia asked only one question: "When's the surgery?" "I'd like to schedule it for 3 days from now. That gives us time to complete the staging workup, PET scan, additional blood work, and for you to prepare mentally and physically." 3 days, Sophia repeated. She looked at Marcus. "Cancel everything. The tour, the appearances, all of it." "Sophie, all of it, Marcus." "I mean it." He nodded, pulling out his phone, his hands shaking. Sophia turned to Dr. Sullivan. "After the surgery, after recovery, will I be able to sing at all?" Dr. Sullivan met her eyes directly. "I don't know. I'll do everything I can to preserve your nerve function, but I have to be realistic with you. The tumor is wrapped around that nerve. Removing it without damage is going to be extremely difficult, possibly impossible. So this is it," Sophia said quietly. "The end of my career, the end of everything. It's the end of one chapter," I found myself saying, "but not the end of the story." She looked at me, her eyes wet but her voice steady. "You're an optimist, Dr. Reyes. I'm a realist," I corrected. "And the reality is that you're 28 years old with a treatable cancer and people who love you. Your voice might change, but you're still here. That matters." "Does it?" she asked. "If I can't do the thing I was meant to do, what's the point?" I didn't have an answer for that. Neither did anyone else in the room. Sophia stood, suddenly restless. "I want to go home. I want to sing while I still can. Just one more time, in private, for myself." Dr. Sullivan nodded. "Go, rest, sing, do whatever you need to do. But Sophia..." She waited until Sophia met her eyes. "Don't give up before we've even started fighting, please." Sophia didn't respond. She just gathered her things and left, Marcus trailing behind, both of them looking like survivors of some natural disaster, shell-shocked and unsteady. After they were gone, Dr. Chen sighed. "That's the hardest part of this job, watching people lose themselves." "She hasn't lost herself yet," I said. "No, but she's preparing to, and I'm not sure we can stop it." I went home that night and pulled up Sophia Navarro's music on my phone. I'd heard her songs before, of course. They were inescapable on the radio, but I'd never really listened. I did now. Her voice was extraordinary, rich and powerful, capable of impossible runs and aching vulnerability. She sang about love and loss, hope and heartbreak, with the kind of authenticity that made you believe she'd lived every word. I listened to her latest album front to back, and by the end, I understood. Her voice wasn't just an instrument, it was her truth, the way she made sense of the world, the way she connected with millions of people who heard their own stories in her songs. And in 3 days, we were going to take her into surgery and possibly destroy it forever. I fell asleep with her music still playing, her voice following me into dreams where I was the surgeon, the knife in my hand, the impossible choice between saving her life and preserving her soul. The next 2 days were a blur of staging workups and preoperative preparations. The PET scan showed uptake in the primary tumor and cervical lymph nodes, but thankfully no distant metastases. Her lungs were clear. Her bones were clear. The cancer hadn't spread beyond her neck. It was good news wrapped in bad circumstances. Sophia came in daily for blood work, anesthesia consultations, surgical consent. Each time I saw her, she seemed more distant, like she was already mourning the person she was about to lose. On the evening before surgery, I found her sitting alone in one of the consultation rooms, staring at her phone. On the screen was a video of her performing at a sold-out arena, her voice filling the space, 50,000 people singing along. "That was 2 years ago," she said without looking up. "Madison Square Garden, the night I knew I'd made it, that I wasn't just Sophia from Riverside anymore. I was someone." I sat down across from her. "You're still someone." "Am I?" She locked her phone, setting it aside. I've been thinking about who I am without my voice, and I keep coming up empty. It's pathetic, isn't it? 28 years old, and my entire identity is wrapped up in one thing. It's not pathetic. It's human. We all tie our identity to something. Our careers, our relationships, our abilities. But those things don't define our worth. They're just expressions of it. Pretty words, Dr. Reyes. But what happens when the expression is gone? What's left? You're left. Sophia, the woman who grew up watching her mother work 3 jobs and decided to honor that sacrifice by building something meaningful. The woman who walked into this hospital at 3 a.m. because she knew deep down that she deserved to fight for herself. That person doesn't disappear because your vocal cords are damaged. She was quiet for a long moment. My mother came to visit today. She held my hand and told me she was proud of me. Not for the albums or the awards or the sold-out tours, just proud of me for being brave enough to face this. She's right to be proud. I don't feel brave. I feel terrified. Bravery and terror aren't opposites, I said. They're partners. You can't have one without the other. She smiled slightly, the first real smile I'd seen from her in days. You're very wise for someone so young, Dr. Reyes. I'm 27. You're 28. We're practically the same age. You feel older, more settled, like you know who you are. I laughed softly. I'm a first-year resident who's constantly terrified I'm going to kill someone through incompetence. I don't have anything figured out. But you chose this, she said, gesturing to my scrubs, my badge. You chose to help people. That's a kind of certainty I've never had. I didn't choose my voice. It was just there. A gift I didn't ask for and now can't keep. Maybe the gift wasn't the voice, I said carefully. Maybe it was what you did with it. The songs you wrote, the people you reached, the meaning you made. That doesn't go away just because the instrument changes. She considered this, her fingers tracing patterns on the table. I wrote a song last night. For the first time in months, I just sat down and wrote. Not for an album or a deadline, just for me. Can I hear it? She hesitated, then nodded. Pulling out her phone, she opened a voice memo app. I recorded it, because I wanted to remember what I sounded like. Before, she pressed play, and her voice filled the small room. It was different from her performance voice, quieter, more intimate, raw, with emotion. The lyrics were about transformation, about dying and being reborn, about losing yourself to find something real. When it ended, we sat in silence. It's beautiful, I said finally, and meant it. It's a goodbye, she corrected, to the person I was, the singer. Tomorrow, after surgery, I'll be someone new. I just hope she's someone worth being. She will be, I said with conviction I didn't entirely feel, because she'll be you. And you're worth being, Sophia, with or without the voice. She looked at me then, really looked, and something passed between us, understanding maybe, or just the shared recognition of 2 people standing at the edge of an unknown future, trying to find courage in the darkness. Thank you, she whispered, for seeing me, not the singer, just me. That's all I've ever seen. The surgery was scheduled for 7 a.m. I wasn't supposed to be there. I was just a resident, not part of the surgical team, but Dr. Chen had pulled strings to get me observing privileges in the OR. You started this case, she'd said. You should see it through. So at 6:30 the next morning, I scrubbed in and entered the operating room where Sophia lay unconscious on the table, a breathing tube secured in her airway, monitors beeping their steady rhythm. Her neck was prepped and draped, the surgical field marked with sterile markers. Dr. Sullivan entered, her team behind her, an ENT fellow, a surgical nurse, an anesthesiologist. Everyone moved with practiced efficiency, the choreography of surgery playing out in silence, punctuated by quiet requests and affirmations. Scalpel, Dr. Sullivan said, and the surgery began. I watched from my position near the head of the table as Dr. Sullivan made the incision, a horizontal cut along Sophia's lower neck, following the natural crease of the skin to minimize visible scarring. Blood welled up immediately, quickly suctioned away. The dissection was painstaking. Layer by layer, Dr. Sullivan exposed the structures of Sophia's neck, muscles, blood vessels, nerves, the thyroid gland itself, and there, embedded in the left lobe, was the tumor. Even to my untrained eye, it looked aggressive. Irregular borders, dense tissue, tendrils extending outward like roots. There's the recurrent laryngeal nerve, Dr. Sullivan murmured, pointing with a forceps at a thin, thread-like structure. The tumor had indeed wrapped around it, just as the imaging had shown. This is going to be delicate. For the next 3 hours, I watched Dr. Sullivan work with microscopic precision, trying to free the nerve from the tumor's grasp. It was like watching a sculptor work, each tiny movement deliberate and crucial. One slip, one accidental cut, and Sophia's voice was gone forever. The room was silent except for the monitors and the quiet sounds of surgery. Everyone held their collective breath as Dr. Sullivan carefully dissected the tissue, millimeter by millimeter. "I can see the nerve," she said finally. "It's compressed, but it appears intact. I'm going to try to preserve it, but..." She paused, her forceps encountering resistance. "The tumor is adherent, very adherent." She worked in silence for another 30 minutes, and then quietly, "I can't save it." The words dropped like stones. "The tumor has invaded the nerve sheath," Dr. Sullivan continued, her voice tight with frustration. "If I try to dissect it further, I'll transect the nerve anyway. I have to take it with the specimen." I felt something cold settle in my chest. This was the moment. The decision that would change Sophia's life forever. Dr. Sullivan proceeded with the resection, removing the entire left thyroid lobe, the tumor, and the section of recurrent laryngeal nerve that had been invaded. The lymph node dissection followed, multiple enlarged nodes removed from Sophia's neck, each one potentially harboring cancer cells. By the time Dr. Sullivan closed the incision, 4 hours had passed. The specimen, Sophia's thyroid, tumor, and nerve, sat in a metal basin, waiting to be sent to pathology. "She's going to wake up without her voice," the ENT fellow said quietly. "She's going to wake up alive," Dr. Sullivan corrected. "That's what matters." But I thought about Sophia's face when she'd said, "Without my voice, I'm nothing," and wondered if survival was enough. Sophia woke up in the ICU 3 hours after surgery. I wasn't there for the moment her eyes opened, but Dr. Chen was, and she told me about it later. First thing she did was reach for her throat. Second thing was try to talk. When no sound came out, she looked at me with such terror. Dr. Chen's voice caught. "I've been doing this for 25 years, Noah. I've never seen anyone look quite like that." By the time I was allowed to visit, Sophia had been awake for 6 hours. She lay in the ICU bed, her neck bandaged, her face pale, her eyes fixed on the ceiling. A whiteboard and marker sat on her bedside table, her only means of communication. Marcus sat beside her, his hand holding hers, his face drawn and exhausted. When he saw me, he stood. "She won't write anything," he said quietly. "She just lies there. The nurses said she hasn't made a sound since she woke up. Not even tried." I approached the bed slowly. "Sophia, it's Dr. Reyes. Can you look at me?" She didn't move. "Sophia, I know you're scared, but you need to try to communicate, even if it's just nodding or shaking your head. Can you do that for me?" Still nothing. I looked at Marcus. "Has Dr. Sullivan been by?" "An hour ago." She explained that the surgery went well, that they removed all the visible tumor, but that the nerve couldn't be saved. Sophie just stared at her, didn't react at all. I pulled up a chair, sitting where Sophia could see me in her peripheral vision, even if she wouldn't turn her head. "Sophia, I'm not going to pretend this isn't devastating. It is. You've lost something crucial to who you were, but you're alive. The tumor is out. The pathology is going to show whether we got clean margins, whether you need additional treatment, but you're here. You're breathing. You survived." No response. "I know that doesn't feel like enough right now. I know you probably wish we'd never done the surgery, that you'd never come to the hospital. But Sophia," I leaned forward, keeping my voice steady. "You made the brave choice. You chose life. Now you have to keep choosing it. Every day. Even when it's hard. Especially when it's hard." Her eyes moved just slightly in my direction. "Progress. The vocal cord paralysis doesn't mean you'll never make sound again," I continued. "It means your left cord can't move, but your right cord can. And there are therapies, surgeries that can help. It will take time, patience, hard work. But your voice isn't gone, Sophia. It's just different." Her hand moved slowly toward the whiteboard. Marcus handed it to her eagerly. She wrote 2 words in shaky letters. "Not enough." I read them and felt my chest tighten. "What's not enough?" She wrote again, "Different isn't enough. Need to be perfect." "Why?" I asked gently. "Why does it need to be perfect?" She stared at me for a long moment, then wrote with increasing agitation, "Because perfect is all I had. Without perfect, I'm nobody." "That's not true." She shook her head violently, tears spilling down her cheeks. She wrote frantically, "You don't understand. My voice was my value. Without it, I'm worthless. Sophia." She threw the whiteboard across the room. It clattered against the wall. the marker rolling across the floor. Then she curled on her side, her shoulders shaking with silent sobs. I looked at Marcus helplessly. He just shook his head, his own eyes wet. I stayed for another hour, but Sophia didn't acknowledge me again. She just cried soundlessly, her hand pressed against her bandaged throat. Over the next 3 days, Sophia remained in that same withdrawn state. The ICU team moved her to a regular room. The speech therapist tried to work with her, but she refused. The psychiatrist visited, but she wouldn't engage. She ate when forced, took medications when insisted upon, but otherwise, she existed in a gray space between life and death, physically healing, but emotionally dying. The pathology came back on day 4. Dr. Sullivan, Dr. Chen, and I reviewed it together. Clean margins, Dr. Sullivan said. We got it all. The lymph nodes showed cancer in 8 of the 15 removed, but none with extracapsular extension. That's good. Stage 3, as we suspected. She'll need radioactive iodine treatment, but her prognosis is excellent. 85% 5-year survival. And her voice? I asked. Dr. Sullivan pulled up a laryngoscopy image she'd taken during a follow-up exam. The left vocal cord is completely paralyzed in a paramedian position. There's a significant glottic gap when she tries to phonar, or would try if she were trying. With therapy and possibly a medialization procedure, she could regain functional voice. Not singing voice necessarily, but speech. Has she tried to speak at all? No. The nurses say she hasn't made a sound since waking up. She's communicating only when absolutely necessary with the whiteboard. She's given up, Dr. Chen said quietly. We saved her life, but she's decided it's not worth living. I thought about that. About the woman who'd walked into the ER 5 days ago, terrified but fighting. About the song she'd written and recorded, her goodbye to herself. About her mother who'd worked 3 jobs and was now watching her daughter disappear into grief. I need to try something, I said. Dr. Chen raised an eyebrow. What? I don't know yet, but I can't just watch her give up. I went to Sophia's room that evening. Marcus had gone home to shower and sleep, leaving Sophia alone with her silence. She lay on her side, facing the window, the sunset casting long orange shadows across her bed. Sophia, can I talk to you? I asked. No response. I'm going to talk anyway, whether you listen or not. I pulled up the chair and sat down, angling myself so I could see her face even if she wouldn't look at me. I've been thinking about what you said, about your voice being your value, about being worthless without it, and I think I understand where that comes from. Your identity has been so tied to singing for so long that you can't imagine yourself as anything else. Her eyes moved, just slightly. She was listening. But Sophia, that identity was always a prison. Maybe a beautiful, successful prison, but a prison nonetheless, because it meant you were only worth something if you could perform, only valuable if you could hit the high notes, only deserving of love if you could fill stadiums. I paused, choosing my words carefully. What if losing your voice is actually freedom? Freedom from the expectation of perfection. Freedom from defining yourself by a single ability. Freedom to discover who Sophia is when she's not performing for anyone. She turned her head slightly toward me. I could see tear tracks on her face, but her eyes were focused now, engaged. You wrote a song the night before surgery, I continued, about dying and being reborn, about transformation. Maybe this is that moment, the death of Sophia Navarro, the perfect singer, and the birth of just Sophia, imperfect, human, real. Her hand moved toward the whiteboard, which Marcus had retrieved from where she'd thrown it. She wrote slowly, "What if Sophia isn't enough? What if she's more than enough?" I countered. "What if she's exactly who you were always meant to be?" She stared at what she'd written, then at me. Then she wrote again, "Scared. I know, change is terrifying, but you've already survived the hardest part. You survived the surgery. You survived losing your voice. Now you get to choose what comes next. You can stay here, in this grief, and let it consume you. Or you can fight, not to get back what you lost, but to find something new." She was quiet for a long time. Then she picked up the marker again. "How? One day at a time, starting with right now. The speech therapist wants to work with you. Will you let her?" Another long pause. Then, slowly, she nodded. It was the first time she'd agreed to anything since waking up. "Tomorrow morning," I said. "She'll come by at 9. And Sophia?" I waited until she looked at me fully. "Thank you for choosing to fight." She didn't write anything else, but when I left, she was sitting up in bed for the first time in days, staring at the sunset through the window, her hand resting on her throat, not in grief, but in contemplation. Maybe, I thought, Maybe this is where she starts to heal. The speech therapy session started the next morning. I wasn't present for the first one, but the therapist, a woman named Dr. Lena Martinez, stopped by my station afterward. She cried through most of it, Dr. Martinez said, but she tried. When I asked her to make sound, any sound, she opened her mouth. Nothing came out at first, but then she smiled slightly. A tiny, breathy whisper, barely audible, but it was there. She spoke, one word, hello. It sounded like wind through grass, fragile, but real. Over the next week, Sophia worked with Dr. Martinez daily. The progress was slow, measured in tiny victories. A whisper became a raspy murmur. A single word became a sentence. The sentences were breathy, weak, nothing like her former voice, but they were hers. I stopped by her room whenever I could between rounds. Sometimes she was working with Dr. Martinez, learning breathing techniques and vocal exercises. Other times she was alone, practicing or resting or simply existing in the strangeness of her new reality. One afternoon, I found her sitting in the chair by the window, her hand resting on her throat as she hummed, a low, breathy sound that was more air than tone, but still music. "That's beautiful," I said. She jumped, startled, then smiled sheepishly. When she spoke, her voice was barely above a whisper, rough and uneven. "It's terrible," but she'd spoken, out loud, not written on a board. And hearing her voice, even this changed, damaged version, felt like witnessing a miracle. "It's different," I said, "but not terrible." She was quiet for a moment, still humming that low note. "Dr. Martinez says I might regain more function, maybe 60 to 70% of normal speech, but singing," she trailed off, "singing is probably over. The way I sang before. High notes, sustained phrases, power that requires both chords working together. With one paralyzed," she shook her head. "I'm trying to make peace with it. Are you?" She considered this. "Some days more than others. Today is a better day." "What makes it better?" She gestured to her throat, to the sound she'd been making. "I can hum. It's not much, but it's something. And something is more than nothing." The pathology had been definitive. All tumor removed, clean margins, radioactive iodine treatment to start in 4 weeks once her thyroid hormone levels had adjusted. Her prognosis was excellent. 85% 5-year survival. She was going to live, but living and thriving were different things. On the day of her discharge, 2 weeks after surgery, Sophia sat on the edge of her hospital bed, dressed in comfortable clothes, her neck scar visible above the collar of her shirt. She'd stopped hiding it with scarves. "Scars tell stories," she'd said in her whisper voice. "Maybe mine should too." Dr. Sullivan, Dr. Chen, and I came to say goodbye. Marcus was already there, handling discharge paperwork and scheduling follow-up appointments. "You did incredibly well," Dr. Sullivan said. "The incision is healing beautifully. You're tolerating the thyroid replacement hormone. Your calcium levels are stable. Medically, you're doing everything right." "And vocally?" Sophia asked, her whisper voice stronger than it had been even a few days ago. "That's going to take more time. Keep working with Dr. Martinez. The exercises will help. And we can discuss medialization surgery in a few months, once everything is healed fully. That procedure can improve vocal quality significantly." Sophia nodded, processing this. Then she turned to me. "Dr. Reyes, can I talk to you for a minute? Alone?" The others excused themselves, leaving us in the room that had been her home for 2 weeks. Sophia stood, walking to the window, looking out at the city stretching beyond. "I've been thinking about what you said," she began, her voice soft. "About freedom. About discovering who I am without the performance. And you were right. I've spent my entire life being what other people needed. My mother needed me to succeed, so her sacrifices mattered. The label needed me to sell records. The fans needed me to be perfect. I needed myself to be perfect." She turned to face me. "But perfect isn't real, and perfect isn't sustainable. I was killing myself trying to maintain it. What will you do now?" She smiled, and it was genuine. "I don't know, and that's terrifying, but also exciting. I canceled the tour, bought out my contract with the label. I'm done performing for a while, maybe forever. I don't know yet. And your music? I'm still writing. Songs sound different in my head now. Quieter, more intimate. Less about proving I can hit notes and more about saying things that matter." She paused. "I recorded something yesterday, on my phone. Just me, alone, with my new voice. It's not radio friendly. It won't sell millions, but it's honest. Can I hear it?" She hesitated, then pulled out her phone, queuing up a voice memo. It's rough, really rough, but she pressed play. Her whisper voice filled the room, singing a melody I didn't recognize. The words were about transformation, about loss and discovery, about learning to love yourself when you're no longer who you thought you were. It was raw and breathy and imperfect. It was heartbreakingly beautiful. When it ended, I realized I had tears in my eyes. Sophia, that's incredible. You think so? She sounded uncertain. I know so. That's not the voice of someone who's lost everything. That's the voice of someone who's found something real. She smiled, and this time it reached her eyes. Maybe that's who I am now. Someone real. Before she left, she hugged me. A brief, tight embrace that said more than words could. Thank you, she whispered, for not letting me give up. You did that yourself. No. You reminded me I was worth fighting for. That's the difference. I watched her leave with Marcus, walking out of the hospital with her head high, her scar visible, her new voice finding its place in the world. 3 months later, I received a package at the hospital. Inside was a CD, handmade with a simple label that read, Sophia, Reborn. There was also a note. Dr. Reyes, I wanted you to hear this before anyone else. It's my first album with the new voice. 10 songs, all written in the past 3 months. It's not what I would have made before. It's quieter, more intimate, imperfect, but it's mine in a way nothing I've ever created has been. I'm not touring. I'm not performing. I'm just making music. For myself. For the people who care about honesty more than perfection. My mother listened to it and cried. She said it sounded like me. The real me. The one she raised. Not the one the world created. I don't know what my future looks like. But for the first time in my life, that's okay. I'm learning to be enough just as I am. Thank you for seeing me when I couldn't see myself. With gratitude, Sophia, I listened to the album that night, alone in my apartment. Every song was raw, vulnerable, sung in that breathy whisper voice that carried more emotion than any technically perfect performance ever could. She sang about cancer, about loss, about rebirth, about learning that your worth isn't determined by your abilities but by your humanity. The last song was called Enough, and in it, she sang, whispered, really, about a doctor who told her she was more than her voice, about choosing life, about finding freedom in imperfection. I listened to it 3 times, tears streaming down my face, before I finally turned it off. 6 months after that, I saw Sophia's name in the news. She'd released the album independently, online only, with no promotion beyond a single social media post. It had been downloaded over 1 million times. Critics called it revolutionary, the most honest expression of artistry in modern music. Fans shared it with each other in hushed tones like a secret too precious to shout about. Sophia didn't do interviews, didn't appear on talk shows, just released the music and let it speak for itself. But she did post one message on her website. For anyone who thinks they're only worth something if they're perfect, you're enough. Broken, healing, imperfect, you're enough. It took cancer and losing my voice to learn that. I hope you can learn it in easier ways. But however you learn it, please learn it. Because the world needs the real you, not the perfect performance. I printed that message and pinned it to the bulletin board in the residence lounge, next to the photo of Richard Callahan's treehouse. 2 reminders, 2 stories, 2 patients who'd taught me that medicine wasn't just about healing bodies. Sometimes it was about healing souls, about reminding people that they're more than their abilities, their achievements, their perfect performances, about standing beside them when they're broken and saying, "You're still worth fighting for." Sophia had lost her voice, but in losing it, she'd found herself. And that, I realized, was its own kind of miracle. Sometimes heroes don't wear capes. Sometimes they sit in hospital beds, learning to whisper when they used to sing, learning to be human when they used to be perfect, learning that their worth was never in what they could do, but in who they were. Sophia's scar was visible now. She wore it openly, a reminder that survival is its own form of strength. That transformation is painful, but possible. That the most beautiful music sometimes comes from broken instruments. I still think about her sometimes. Wonder if she's still writing music, still learning to live with her changed voice. Wonder if she's found peace in the imperfection. But mostly, I carry her lesson with me. Every time I see a patient who's facing a loss that feels insurmountable, I remember Sophia's journey from despair to acceptance, to something that looked surprisingly like joy. And I tell them what I told her. You're more than what you've lost. You're everything you still are. And that's enough. It's always been enough.